We'll now talk about the equipment that is present in the room that you'll be using with the simulators. So first, just inside the door here, we have a rack that has a box in it that contains gloves. Below that rack, we have a basket that contains masks and gowns. So this is the personal protective equipment station. Depending on the goals of the activity you're engaged in and the wishes of your instructor, you may or may not be wearing masks and gowns. Remember, however, for all activities where you're going to touch the mannequin, you do need to wear your gloves to protect the mannequin from skin oil. In all the rooms, there will be a mail stand that will have a Foley catheter tray on it. You can catheterize the mannequin. Please remember there is betadine in these kits. Throw the betadine away. You can use alcohol to clean the mannequin. Also remember, when you're catheterizing the patient, you may or may not get a return of urine depending on the wishes of your instructor. That may just be something that you are told when you place the catheter, that urine is returning. There's a table in all the rooms or a cart that will have dressings and bandaging material on it. There also typically are baskets on the wall in each room that contain a variety of different types of dressings and bandaging material. In each room, there always is at least one sharps container that is attached to the wall. Please dispose of all of your sharps into the sharps container exactly the way you would if you used them on a real patient. Even though the patient does not have blood and other body fluids and does not represent a bloodborne pathogen risk, you are generating sharps that can injure people and that do have a minor risk for transmitting diseases like tetanus. So please be careful with the sharps. Dispose of them in the sharps container. In all of the rooms, there is a small cart or a table that will have some material on it for simulating soft tissue injury management. That table also typically has tape on it. There will be trauma shears, a reflex hammer, and a tuning fork in each room. There will be another cart that will have material on it for vascular access and blood draws. So here we have the blood draw materials. We have a variety of different types of vacutainers. We have vacutainer holders, needles, tourniquets, and Band-Aids. We have alcohol prep pads here, along with 2 different sizes of IV catheters. We have the 20 gauge catheters, which are the largest ones that we will ever use on our simulators. And for pediatric scenarios, we have a box that contains 24 gauge catheters. And on this side of the cart, we have vacutainers for pediatric blood draws. In each room, we also have some manual intraosseous needles on this table. Each room also contains a small, difficult airway cart. On the top of this cart, you'll find a nasogastric tube and a catheter-tipped syringe for NG tube insertion. There is a small crike kit that's been put together as a little open crike kit for surgical airway access. There are the syringes that you need with the various alternative airway devices. There also is a King LT airway, an LMA, a combi tube, and an air track device for endotracheal tube insertion. The difficult airway cart also includes lighted stylets, bougies. Those will typically be in the top drawer of the cart. Further down, there will be an intubating LMA in the drawer. There also will be equipment in that drawer for placement of a endotracheal tube by retrograde intubation. So in this drawer, we have scalpel, we have a hemostat, we have a guide wire, and we also have a Cook exchange tube to help with guidance of a retrograde tube. We also have tracheostomy tubes in these carts, as well as other types of cricothyrotomy kits. So we have a milker cricothyrotomy kit in this cart. We have a pediatric kit, and we have a Nutrake style cricothyrotomy kit. So this is your difficult airway cart here. In each of these rooms, there are two types of monitors mounted on the walls. We have a small monitor here. We have a larger monitor mounted on the opposite side of the room. Those monitors are for different types of simulators. You'll use the monitor that has been turned on when you come into the room. So if one of these monitors is off, ignore it. Use the one that already has been turned on. If you are using the smaller monitor, the oximeter probe that's used with that monitor will be in the basket closer to the monitor below the simulator link box. The head wall is a live head wall with medical grade gases, so you have access to vacuum, oxygen, and air on the head wall. Please, if it's part of the activity, flow the gases the way you would with a real patient. The only thing we ask is immediately on conclusion of the activity, before you do anything else, please turn off the flow meters. That's particularly important with oxygen. We are flowing real oxygen. We don't want to waste it. So please turn the flow meters off immediately on conclusion of the activity. If your instructor tells you to, rather than hooking up to oxygen during the activity, you may be told to hook up to the compressed air flow meter and act like it is oxygen, because some of our instructors prefer not to waste the real oxygen. They simply say, hook to the air flow meter, that is your oxygen access during the scenario. Oxygen administration devices are on the baskets below the head wall. Pediatric devices are on this side, along with pediatric bag valve masks. There is an adult bag valve mask that hangs here on the head wall. The adult oxygen administration devices are on this side. You'll notice that our O2 administration devices are in Ziploc bags with labels on them. When you select a particular device, please open the slide on the Ziploc bag to take the device out. Lay the bag in a location where you are going to be able to find it easily later. Once you've completed administering oxygen to the patient, go back to the bag, replace the device in the correct bag, and then close the Ziploc, place the device back in the basket on the head wall. Please do not rip open and throw away the bags that these devices are in. They are intended, the bags and the devices are intended to be recycled. Moving on, we have the monitor here that goes with the SimMan Essential Mannequin. So this is the monitor you'll be using when you work with this simulator. The monitor is a touch screen. So to activate any feature on the monitor, simply tap the monitor and the feature that you selected will turn on. There is no need to attach any leads to the mannequin to get data from this monitor except for pulse oximetry. To get a pulse ox reading from the SimMan Essential, you'll need to take this probe, which you'll notice is attached to the SimMan Essential monitor, and you'll need to clip the probe onto the patient. Once the probe is in place, you'll get oximetry data on the monitor. If the probe comes off, it's like a real pulse ox, you'll lose the data. Also, if the patient's blood pressure is extremely low, the monitor will give you a low signal warning where you would be seeing oximetry data. So if you're seeing low signal on the monitor, that's an indication that your patient has an extremely low blood pressure and the oximetry probe can't see flow, so it can't read an oxygen saturation. Down in this corner of the monitor, we have a place to read non-invasive blood pressure. To read a non-invasive blood pressure from this monitor, simply find the button down here that has the little icon of the man with the BP cuff on his arm that says start stop. Press that button. You'll hear the virtual blood pressure cuff inflate. And then in a few seconds, your BP will appear in the lower left-hand corner of the monitor screen. You don't have to actually put a BP cuff on the mannequin to get a BP from this monitor. However, some instructors ask their students just to take the little Welch Allen portable machine over and place the cuff from this machine on the patient's arm. That's an indication that they want to monitor blood pressure continuously. So again, ask your instructor about that. Some of them will want this cuff on the patient's arm before they will allow you to cycle a BP on this monitor. The other important thing for you to understand about the traces on this monitor is that the instructor also can turn them on and off from the control room. So if you turn on something, for example, like an arterial blood pressure waveform, and you have not talked about putting an arc line in the patient, the instructor will probably turn this off. If you turn on capnography monitoring, but you don't have any equipment in place to monitor the patient's exhaled CO2, you'll probably see this data stream disappear from the monitor very quickly because the instructor will turn it off in the control room. Now, you can see on the monitor there are a variety of different controls that appear down here as you turn on various data streams. Notice at this end there is a set of arrows to tab over to an extension of those buttons, and on the extension we have a button for radiography. If there are x-rays that are loaded up as part of the scenario you're running and you touch this button, a window will open where you'll be able to see those images. Okay, and frequently instructors will tell their students, before you look at the images, you have to order them. At that point, you'll be allowed to access them through the radiology button. There also is a button here on the toolbar that allows you to bring up a 12-lead electrocardiogram on the patient. This 12-lead ECG is linked to the patient's underlying rhythm. So if the patient, for example, is having ectopic beats and throws an ectopic beat, while you're recording the 12-lead ECG, you will see the ectopic in the appropriate leads on the 12-lead ECG. So remember, if you're looking for something like images or a 12-lead ECG and you don't see them down here on the gray buttons on the toolbar, remember the tab over button to get to those additional controls. Over here, we have a crash cart. The crash cart is set up to resemble an actual crash cart. So first of all, there is an ECG monitor and a suction on the cart. The ECG monitor can be connected directly to the SimMan. We've already talked about that. You simply clip the leads onto the posts on the mannequin's chest. The top drawer of the crash cart contains medications. This crash cart is much better supplied than a typical hospital crash cart. There are more meds than just the typical code or emergency meds in the top drawer. That's to simplify the process of getting to the medications during scenarios. On the side table of the cart, there is an inventory for the top drawer that tells you what drugs are available and where they are located in the cart. The second drawer of the crash cart contains supplies for endotracheal intubation. So we have laryngoscope handles and blades, both curved and straight. We have an esophageal detection device, PEEP valve. We have a BAM for nasotracheal intubation. We also have a bottle of neosynephrine that can be used to simulate use of a vasoconstrictor to help with nasotracheal intubation. We have commercially available tracheal tube securing devices. On this side of the cart, we have ET tubes. With the simulators, we never use a tube that is larger than a 7/0 tube on an adult mannequin. That's simply to protect the patient's airway. And we have endotracheal tube stylettes in the same portion of the cart. The carts also contain colorimetric CO2 detection equipment. So we have this easy cap device. The mannequins will exhale carbon dioxide. So an easy cap can be used to detect color change to verify proper placement of the endotracheal tube. In the next drawer of the crash cart, we have a variety of different sizes of syringes and needles for use with the simulators. Again, please remember, never stick the simulator with any needle that is a larger bore needle than a 20 gauge. The next drawer contains IV catheters of various sizes that are primarily there just to help with the illusion of it being an actual crash cart. When you work with the simulators, please use the 20 gauge catheters off of the vascular access cart that you saw earlier. The next drawer down contains IV tubing of various types. It also contains nasogastric tubes. Again, this is primarily for scenery and to help with the illusion. The bottom drawer of the crash cart contains various types of IV fluids. That allows the cart to be moved elsewhere in the center besides the emergency department and be used there, particularly in simulating hospital codes for setting up the IV during a code on the floor, for example, in another part of the simulation center. However, we typically do not use this drawer in the emergency department. Instead, we have a pre-spiked bag of fluid that is hanging by the bed. If your instructor wants to use the pre-spiked bags or wants to have you actually start IVs and set up the entire fluid administration system with the bag and the tubing during your scenario, they'll let you know that. Continuing around the room, we have the little Welch-Allen blood pressure monitor. Again, this is used during scenarios when you want to simulate continuous non-invasive blood pressure monitoring. Put the cuff on the patient, but remember, you'll see the blood pressure appear on the simulator's monitor. In each of the rooms, we also have a chest tube trays contents that have already been laid out. for placement of a chest tube. There will also be a Pleurovac somewhere near this set. Okay, and finally, on this side of the room, a whiteboard that can be used for charting during the scenario. Also, near the whiteboard in most of the rooms, or somewhere near the door of the room, there will be a telephone. Near the telephone is a telephone directory. Using these telephones, you can call between the various areas of the simulation center. So if you need to talk to another trauma room, or if you need to talk to the ICU, you can call using this directory. Also, there's a number on the directory that will allow you to reach the control room. Your instructor will tell you during the pre-brief for a scenario whether or not they want you to call other areas of the hospital. And if it's another area like the lab or OR control, you use the control room to reach that area. During a scenario, you also may be receiving calls from other areas of the hospital like the lab. Those calls will originate from the control room, but the person calling will tell you this is the lab or this is OR control, depending on who they're simulating. Final comment, you'll notice that on the walls of these trauma rooms, we have the ACLS algorithms. The pediatric algorithms are on one side of the room. The adult algorithms will be posted on the other side. Those are there to simulate good patient safety practice, particularly during emergency situations. You shouldn't rely on your memory. You should look it up. And that's why we have the posters on the walls. While you're managing a patient, if the management includes following one of the ACLS algorithms, go to the appropriate poster, follow the flow of the algorithm on the poster. Okay. Again, when you work with these simulators, suspend your disbelief. Think of the simulator like it is a real patient. If you will actively suspend disbelief for a few minutes, then the patient will become real to you. At that point, simulation is probably the most effective way to learn any healthcare profession, short of actually doing it. And we've said that the Welch-Allen monitor being applied to the patient is simply a way of telling your instructor that you want to use the non-invasive BP feature on the patient monitor. It is possible to use an actual BP cuff on the SimMan Essential. To do that, we place the cuff on the patient's arm the way we would with a real patient. And after you do that, you'll notice that you have a gauge for reading the patient's blood pressure. And of course, you have the bulb for inflating the cuff. But then there's this extra tube. This extra tube is critical in making an actual BP cuff work with SimMan Essential. And if we move over here to the patient's side, you'll notice we have a small port down here. This tube clips onto that port. So now we have the BP cuff connected to the simulator. That connection allows a pressure sensor inside the mannequin to measure the pressure in the cuff as you inflate it and deflate it. That in turn allows the computer to turn the sounds off and on at the correct time. So for an actual BP cuff to work with the SimMan Essential, this tube has to be clipped onto the white port that you'll find on the patient's side just below the point where the defibrillator cable and the red ECG lead clip. When you have finished your activities for the day, it is important that you help the simulation center staff by attempting to put the room somewhat back into order. So, things that we would like you to do. First, please remove all probes, all cabling from the patient. Take the oximeter probe, coil the tubing neatly. Please hang it back over the oxygen flow meter. We'll remove the BP cuff for the patient. Remember, the BP cuff is clipped to his side if you've been using a manual BP cuff, so please unclip that. Remove the ECG leads from the patient. And the defibrillator cable. Neatly coil the cable. And place it into the pouch on the same side of the monitor as the side where the cable connects. So you notice the defibrillator cable is connected to the right side facing the monitor. I place the cable back into the right pouch. The ECG cable connects onto the left side facing the monitor, so I place it into the left pouch. Take any oxygen administration devices, put them back into the baskets on the head wall. Please be sure that all gas flow is shut off and that the flow meters are tight. With the SimMan Essential, it's very important to remember to power down the simulator. There's a power button here. We will push that button. At this point, the simulator is in the process of shutting down. You'll notice that he has stopped blinking. And if we look up here at the monitor, we notice that we now have lost the data streams. We just see square waves everywhere. That's a confirmation that we have powered down the mannequin. Plus we have a message that tells us the connection to the mannequin has been lost. So we will click out of that, and now we'll go through the standard Windows sequence to shut down this monitor, which actually is a flat panel computer. It's extremely important with the SimMan Essential to remember to power down the mannequin. There is a computer inside the mannequin. If you leave that computer on, it eventually will go to sleep, but in the meantime it can generate a lot of heat that has the potential to damage the mannequin. Also, once you shut down the mannequin, please remember to turn off the monitor. We'd also ask that you take a final look around the room. If you have any syringes that you've taken out of the crash cart, please return them to the correct place in the crash cart. If you have taken airway management equipment out of the crash cart and laid it elsewhere, please return it back to the second drawer of the crash cart. Also, remember that our general rule here in the simulation center is that if it is not sharp, it gets recycled. So all sharps should have gone in the sharps container. All other equipment, drug vials, nasogastric tubes, equipment that came out of any kit, like a Foley catheter kit, should be set off to the side and it is likely to be recycled for use in other scenarios. So if it is not sharp, please save it. It needs to be reused to help hold down costs in the center. That concludes our orientation to the SimMan Essential Simulator and the Simulation Center Trauma Room. Thank you very much for watching.